supporting youth with foster experience in the crisis care continuum. And again, this is session 2, focusing on best practices for continuity of care along the crisis continuum. So quick disclaimer, this training is offered through the Crisis and Recovery Enhancement TA Center and is funded by the California Department of Healthcare Services and administered by the Center for Applied Research Solutions. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the California Department of Healthcare Services. And in the event of a security issue, we don't anticipate any issues, but in the event that one occurs, the session will immediately end and we'll will not resume. We'll send a separate email to all of you with further instructions. The Crisis and Recovery Enhancement TA Center, excuse me, provides a comprehensive array of training and technical assistance services to California's Mental Health Services Act funded stakeholders and partners that we support counties and partners with strategically planning and implementing and evaluating their behavioral health coordination and crisis response efforts. Our TA Center is a collaborative of experienced partners like our host today at Stanford Sierra Youth and Families. It also includes Center for Applied Research Solutions as the lead agency, as well as RI International, National Alliance on Mental Illness, NAMI, the California chapter, C4 Innovations, as well as the Research and Action Center at Impact Justice. So all together and collectively, these partners embody and provide the well-rounded knowledge base of the crisis care continuum. As noted before, we offer comprehensive training and technical assistance. This includes listening sessions, our resource library, quarterly newsletters, and content digest, which you can access on our website. So that brings us to today's session. And I'm very excited to welcome in my colleagues at Stanford Sierra Youth and Family to be talking today about best practices for continuity of care along the crisis continuum. So I will go ahead and hand the mic over as we move into introductions of the team. Thank you all for being here.
It's a pleasure to always be here and share space with the CARE community, as well as with everyone who has joined. My name is Ebony Chambers, and I am with Stanford Sierra Youth and Families. There, I'm the Chief Family and Youth Partnership Officer, and work with an amazing team that provides a number of different peer and mentoring supports to the greater Northern California community. We have programs in Sacramento, El Dorado, Yolo, Napa, Placer, and Nevada counties, and continuing to grow. The services, particularly that we're a part of, are peer delivered services, whereas I and a number of my colleagues here in this space have lived experience navigating behavioral health, juvenile justice, or child welfare systems, and work with youth and families to partner with them with system navigation, supporting them along the crisis continuum to ensure that they are equal partners, if not leading their service delivery through empowering their voices, their choice, as well as just strong collaborative partnerships to ensure they have all of the services and resources they need as they're navigating such a complex system. I'll share more about what we do and how we do things. But for now, I'll pass it along to Kibran. I know that Ayana shared, if you don't mind putting in the chat where you're from, but also if you don't mind adding anything when you joined this workshop, if there were areas that you were particularly interested in learning about. We do really want to ensure that this time and space is held for those that have taken the time out of their day and made the commitment to join. So if you do have questions, ideas, thoughts that you'd like to share with us, don't hesitate to place that in the chat so we can ensure that this time together is meaningful for you.
Hello, everyone. My name is Kibran Mendez, and I am the Director of Quality Improvement at Stanford Sierra Youth and Families. And within the agency, I support with program and agency evaluation, system practice updates and development, and the support of all of our staff and the families that we serve in ensuring that we have consumer and family-driven interventions and practices that support the needs of the community overall. And so I'll pass it on to Tamisha.
Good morning, everyone. My name is Tamisha Wallace. I am the Youth Advocate Manager in our Family Youth Partnership Program. I'm supporting youth advocates across our mental health programs as well as our juvenile justice. We also have a CSEC program where we're supporting youth who are high risk for sexual exploitation or who are actively being exploited. Advocates utilizing their lived experience to work alongside families to make sure that their voice is, as Ebony mentioned, the forefront of services, and we're being as preventative as possible. So I'm excited to have that conversation with you all today and talk about how we support our families.
Hi, everyone. My name is Christina Cagle. I'm the Director of Family Youth Partnership at Stanford Sierra Youth and Families. I know that we've all said that, but there it is, one final last time. And so as a director, I'm really looking at bigger picture program perspective, also someone with lived experience as a parent with having a youth join our family through child welfare and then having some crossover into juvenile justice. We utilize our lived experience to make sure that family voice and choice is at the front of all services. And that goes like from system development and process, as well as really implementing change in the community and what we impact and touch. So that is me.
Awesome. All right. And we know that a number of you may have joined previously, or maybe this is your first time joining. We'd like to launch a poll now to find out if who's here in regards to if you've been to one of the first series or not. Perfect. And thank you. Looks like we've got about 50-50. So about half of you previously joined. So those that did, welcome back. And if you did not, that's totally all right. Welcome to this webinar. We have an opportunity to review a little bit of what we checked in about the last time, but new information that won't conflict with you missing that first session. So our agenda today, we have already done those introductions and a little bit about ourselves. We will also continue to share more as we go along. We're going to do some follow-up. Last webinar on February 28th, we introduced the Plan, Do, Study, Act. So we'll follow up, see for those that were in that first session. And if not, we're happy to provide you with the document as a handout so that if you are interested in finding ways to check in on new strategies that you're planning on introducing into your organizations or departments, the Plan, Do, Study, Act is a great way to do that. So we can share that document. We'll talk about the ways that we provide crisis support in the varying phases of care so that engagement, planning, implementation, and transition, and what we do. And we'll also provide a document and handout for that. And then how we elevate and integrate family and youth voice to improve crisis service delivery. So here's a little bit about our mission and our vision. Transforming lives by nurturing permanent connections and empowering families to solve challenges together so every child can thrive. And our vision, we envision our communities with safe, lifelong connections for all young people, built and strengthened through generations of empowered families.
Right. So Plan, Do, Study, Act, or PDSA for short. So we did an introduction to the Plan, Do, Study, Act process in our last learning session. And we talked about using this as a method to be able to support with examining kind of your crisis continuum. How is it being accessed by individuals and families? How do individuals know how to access your crisis services from both a preventative format to also post-crisis situations? And in talking about our Plan, Do, Study, Act, we had asked many of you to kind of start developing what's your PDSA 1.0 cycle? Because one of the things that we talked about is that they are cyclical, that one PDSA feeds into the next one and feeds into the next one. That you might be starting from a place that says, we've been informing a lot of our families about how to access crisis services, but we notice that families don't actually use them. And so your PDSA might be examining what are the experiences that family have in why they don't use them, or who uses it and why do they use it, to kind of be able to start your process in developing a practice implementation or an update to your practices so far. Some of you might have said is, well, we haven't really talked to families about their experiencing using our crisis services, so we're unaware. So maybe our first PDSA might be to ask families about their feedback, engage in a panel or a listening session or a survey to be able to look into that process for individuals. So with that, we had also said one of your call to actions could be to create a monitoring committee. Who is going to be your Plan, Do, Study, Act team that will be reviewing what your implementation is, or what data points you need to be looking into to kind of be able to foster that communication with youth and families that you serve and what their experience has been. So I wanted to highlight in this PDSA conversation today, as we talk about best practices, one way that we as an agency have been doing it. And in the quality improvement department, we have monthly meetings with all of our programs where we have a QI consultation. In those consultations is our format of us being able to check in on how's our PDSA going. I will tell you that sometimes there are more formal conversations where we're kind of breaking down a list of questions in our consultation to say, you know, what are the issues that have been brought up? What are some brainstormed ideas? How do we know that this information is impacting individuals? What is the data telling us? And sometimes in that hour consultation, we might say, we need more information to answer these questions. Let's break it down. Let's come back within a month. Or sometimes let's come back within a work group in 2 weeks to be able to kind of move this along because it impacts our families. Other ways that we also kind of engage in that is by doing a review of data within our electronic health record to inform, you know, data points and how use is being done. To highlight some of these examples of best practices implementations from these monitoring meetings or these discussion meetings, we sometimes are looking at new practice improvements. Other areas are we're looking to test our theory. So, hey, we are seeing that we need to do a new implementation to how families access our on-call services, our after-hours crisis support hotline. And we're trying to see how to make families feel comfortable accessing it and being informed in it. And so we might do a review of how are all the programs informing their families? At what point in time are they informing their families? Are they doing it verbally? Are they doing it with a handout and a brochure? Is it being done consistently? Or are there opportunities for update for that process? And as we develop a new implementation or a rollout, we're also looking to say, did this rollout work? Did this implementation process really support the individuals? And from the results of that, are we ready to generalize it to everybody to say, this is an effective method. We did it with one program. We want to do it with all of our programs within our agency. I'll give you an example of one that just came up recently. I recently got an email from Family Youth Partnership letting me know that, hey, we had went and we checked in with our shared leadership team. Our shared leadership is composed of families who are receiving services actively or have received services recently. And they come back as a team to work with program leadership to be able to influence how our service is being delivered from a family perspective of who's receiving it right now. And do they meet the needs of the youth and families that we're serving? And it allows us to kind of really get in the moment feedback, process updates, challenges, and they help us review, do your policies and procedures match the needs of the youth and family that we serve? And in a recent discussion, some of the feedback came back that the way that we ask post-crisis, how did families do using our on-call system? We got some feedback that says, hey, the way you collect data might not be the best way to collect data. I might still be in crisis, and therefore you sending me a text message with a link to complete a SurveyMonkey may not be the most effective. Are there different ways you can reach out to a family? Can you make it a conversation? Can you follow up in different ways? So how are you implementing different feedback opportunities to be able to monitor this method of collecting data? Is it even the best way to collect data? Is it the most fruitful? And is it the most supportive to the families in need? So we're actively gathering information from individuals, and it got something that got sent to me and it's getting added to the agenda to check in next time as a group overall. So a really great example of how, again, actively monitoring things in your PDSA check-ins support in developing practice improvement and brainstorming options.
Our philosophy in action, our philosophy really is rooted in nothing about us without us. So really highlighting and elevating voice and choice of families, because services are made to serve youth. Services are made to serve those caregivers who are supporting their kids in the process. And so anytime we are off of that, then we have a problem and need to recalibrate or use our PDSA, right, to get back on track and to fix how we may have gotten off track. So here we have just a little bit of what we do, of our philosophy in action. Parents and kin who have supported their children. That's when we talk about voice and choice, we're talking about parents or kin, because it may not be a biological mother or father. It could be an aunt, it could be a grandmother who's parenting again. It could be a godmother who stepped in, right? Or a close family friend. Also young adults, we want them to have a voice in their process and services. So those youth that we're also talking about, we want them to uplift their voices and make sure that they're sharing. And another way that we utilize our philosophy in action is making sure that there is a family partner and a youth advocate embedded in each program at Stanford Sierra Youth and Families. So while you may have a program full of professionals, you also have someone with lived experience, whether now, navigating some system of care, who is embedded in those team meetings, in those leadership meetings, they're in interviews, they're in trainings, to make sure we're solidifying and upholding family voice and choice at the center and really keeping it centered on nothing about us without us. So here's an example of all of the programs that we offer and what we do. So you heard a little bit from Tamisha about our CSEC program. We have a program specifically targeted to support youth that are at risk of being exploited or who are currently being exploited. We have connection and collaborations with some counties where we're co-located, we're embedded in child welfare offices, and we're able to connect with county workers right there in the moment about how do we best support this family who is probably shaken up, not sure what to do, about how do I get the services that I need so that my family can be reunified, or how can I make sure that we have the services we need so that there is no child leaving my home, right? Like the child can stay here and I can receive services. And the folks who are embedded in child welfare co-located teams, they're folks with lived experience because they've navigated that system of care. So they can speak to some of the challenges that families can face. They can speak to how difficult it can be at moments, which is, I think, one, validating and confirming. Again, housing navigator, those folks have experienced or have supported someone who's been unhomed, and so they can come alongside and validate those families. Our Empowerment Training Center, we're going to talk about that later, so I'm just going to put a pin in that one for right now, as well as, well, actually, I don't see Rizo on here, but Rizo we'll talk about too. But this is just all the ways in which our program really makes sure that we're constantly seeking, because that's important, right? Seeking and validating parent and youth who are receiving services and are at the center of it all, right? We wouldn't have a job, unfortunately, if families weren't in crisis. We wouldn't have a job if families didn't need support and help. And so we're really talking about supporting youth and families. Then services need to be best suited to support them. And that means listening. Do you guys have anything you want to add?
I was just going to ask Christina, as you talk about advocates working and supporting alongside our direct care staff and in our programs, but what does that also look like from a co-partnership with leadership teams, clinical teams, and how they kind of also support in those roles to kind of advance the family and youth voice in all the service delivery that's being done? What does that look like, and how often do those meetings occur?
So thank you. That's a really great question and setup. So I think that when we get to partner with clinicians, sometimes that looks like an impromptu consultation, and sometimes it can be scheduled, but for sure it is happening frequently. And as there is a family partner or a youth advocate on every treatment team, those treatment planning sessions that are happening before service delivery Our family partners and youth advocates are at the table saying, what's the plan? What's the treatment goals? Have we checked in with the family? Does the youth really want to work on that as a behavioral treatment plan, right? Because we've had kids who have said that this doesn't feel like an area I need to work on. And sometimes there might be conflict of what the clinician or the clinical team may express as the need, but then how do we make sure that we elevate what that youth is saying? Because we don't want to miss something in that process. Maybe the kid needs to feel confident in going to school before they can feel confident in conquering, behaviors like cutting themselves. So I just think that's just an example. We have family partners and youth advocates on the executive team level. So we're constantly hearing about new processes and procedures and making sure that family voice and choice is embedded and uplifted there. We also have it in leadership team meetings in every program so that we're making sure we're giving feedback constantly. I think that's the other piece, is just making sure that we're providing feedback anytime services miss the mark or we can be better. And so that's something that we do.
I also want to add one thing about family finding. Just sticking true to our mission and vision about empowering families and generations of families. Something our team also supports with is identifying family members and strengthening youth's natural support system. Unfortunately, we are service providers and we will step back one day. So we want to make sure that we're identifying any natural supports that these youth may have in regards to placement. That could be an occurrence of a crisis situation, if a placement doesn't work out or if a youth doesn't feel connected to that family. A few years back, we actually lost a youth to gun violence. And after his passing, we found out through a news article that he had many family members who were actually looking to be connected with him, but it had never happened through any of his team members. So that's unfortunately a tragedy that could have been prevented had we maybe did a little work to dig a little deeper to see who was connected to this youth and make sure he had a stable placement with family who could have held him and protected him. So I really want to mention that because I think in regards to crisis, that is something that a lot of our youth are looking for, is connection and stability and family. And I love that our agency also has a very fine focus on that.
And I think that I appreciate you for saying that because while we call it family finding, the family was never lost, right? We need to see the family. And so how do we help our county partners, our other service partners, right, that we're collaborating with to surround a youth and services? How are we asking the question? And so we really focus on how do we give our youth advocates and family partners who are part of these teams just things and views and lenses to think about so that when we're collectively in the room together, we're saying, where's their family? How do we have conversations about that? Oh, there's an aunt that was named and we're not talking. Well, let's bring that back up. Let's really look at family. We don't need to find them. They're there. We need to properly see them.
So family partners and youth advocates are a part of the interviews for new hires, the intake process as well. So when families are first coming into services, we're really there to make sure that there's a bridge to understanding what's available to them, what resources are there, because we know that oftentimes at that initial intake, our families are in crisis. They are looking for what can be supported and changed right away. Some real strong takeaways from what they're experiencing and how that might be able to be shifted. And so family partners and youth advocates are there to provide support, but also see if they could be linked to any outside immediate resources that helps them with that crisis. And so one of the things we also are mindful of is that families describe that crisis in a way that's really individualized to their family. So sometimes it's housing, sometimes it's, maybe violence in the community or violence in the home. Sometimes it's a food insecurity. And so all of those are different ways that families might be, and there's many more, but just some of the ways that families may be experiencing a crisis at the intake. And so one of those layers is having the advocacy team be there to provide that support and linkage. And then for in in the work, if you will, providing ongoing trainings to youth, to families, but also to our team members, being a part of those team members, providing coaching and feedback to team members, as well as skill building and linkage to our support groups, which if we have the opportunity, we'll also share the types of support groups that we have. And also as a resource to youth and families, those support groups are open to all families in all communities. So if you can take that flyer and also feel free to share it with your youth and families. We'd love to make sure that that's one way we can build bridges with families, is making sure they're connected to as many resources as possible. So if that's something that's helpful to you, please do feel free to share those the support group flyer. It has links to the different types that we have. And then we also know that change and advocacy for services, particularly crisis along the crisis continuum, do not happen from just us working with youth and families or working with internal staff. There's also a need to externally engage our community, to provide advocacy to our county, our state, and our national systems as a part of systems change. So we're a part of many committees. In California, particularly, we have the Mental Health Services Act. And so we are discussing monthly, if not more than that, opportunities to engage community, opportunities to impact how crisis services are being provided, what peer engagement can look like on a national level as 988 is being rolled out. And then with our youth and families, that external engagement through shared leadership, which Gibran shared, as well as RISO, our Resilient Youth Speak Out, and opportunities for them as well, and young youth to be able to share their feedback and their ideas on service delivery. And so these are our family-centered practice principles. And when we're looking at these, this is really serves as, I say, the foundation and the umbrella. So really kind of like, how do we look at and work with youth and families along this continuum? And when we're doing that, these are our guiding principles to do so. So whenever we're struggling, whenever families are coming in, we really want to make sure that they understand that we're going to have a strength-based approach, that we're not just looking at families through the lens of their problems, but what they're doing well, what they've accomplished so far, and helping them to vision what their family needs and wants in the future in a positive and strength-based way, which can be particularly challenging when we're first having that intake and families are in the crux of a crisis and all they're seeing for themselves is a lot of the negative things that are happening in their lives. And, and from my own lived experience, as much as I, saw lots of strengths in my own kid as we were navigating, it was really hard to see my own because I felt like I was failing as a parent. And so, having a team of support there that took a really strength-based approach in their service delivery was particularly helpful for me, because they were able to elevate areas that I was doing well, and we were able to build on that and include it in our crisis planning. And we have many others here. That's just one example of that strength-based family voice and choice, as you've probably already heard from my colleagues and myself, is particularly important for our organization. We have the saying, and you saw that probably on the previous slide, nothing about us without us. And that just really says that we cannot implement services, plan for services, change services without ensuring that family and youth voice are integrated into every part of that model. So we really lean to and continue to hope to achieve what we call co-production, which just means that everything we're doing is being co-produced with our youth and families in mind. And Gibran shared the example of the on-call follow-up, and that we were checking to see, we've been shifting our on-call process. We've been shifting how we're following up with families, and we can't just change those things without asking families, does it work for you? And as we were gaining feedback, so much valuable feedback over the last few weeks, it was very interesting and such a highlight to see why they were saying this might have worked and what didn't work. And as we were brainstorming, we knew that we needed to go back to our families and get more information to ensure that as we shifted things again, especially as our climate continues to change, the pandemic has shifted things. And so we know that families are tired of, say, too many emails or too many text messages or too many things virtually, that we continue to keep shifting and evolving to meet the needs of our youth and families. Another huge part of these family-centered practice principles are the natural supports. Nationally, we see the research shows that when families have a large support system of folks that they can rely on that are not paid professionals, that their opportunities for what we would call self-efficacy and long-term success, reducing their recidivism, so coming back into our systems of care, is greatly reduced when their natural support system is strong. And so you'll see in later slides, as we're sharing some of the ways that we partner to along this crisis continuum, is the blending and increasing of natural supports into a family system is extremely important to that. And peer partners find ways to work ourselves out of a job by introducing ways that we can build that natural support system. So we have 4 phases of supports on teams. So as we are working with families, as they are experiencing the services, the many different services that we shared previously, we still kind of see this through 4 main phases, and that's engagement, planning, implementation, and transition. So here is what we are doing in engagement. And so I shared oftentimes that our families are coming in and experiencing at times crisis. And so at those very first intake meetings, our team is working with them to address that immediate safety planning, to address either current crisis or potential crisis that may come up. This doesn't stop the crisis planning that's going to happen after we've gathered more information. But what we do know is that initial intake meeting, families are having to share a lot. They're starting some assessments potentially. They're signing a bunch of documents. And when they're walking away, we heard feedback that families are saying, I need more. I don't want to just sign a bunch of paperwork. I have a lot to say. There's a lot going on. And I want some really quick potential fixes to what's happening. And while we know that this isn't a long-term plan to set up and address with families some of the immediate safety needs that families have, allow them to be able to take that exhale or that deep breath that they need, so that they know long-term we're going to be there to provide that support and be able to address some of the long-term safety things, but those immediate areas we can start to address with them right away. So family members, caregivers, and youth, they are the ones who are determining the need for support with a youth advocate or a parent partner or family partner right at that intake. It's decided, their relationship is discussed, what's needed. Sometimes they're coming in through the intake and they're saying, whoa, a lot of team members, maybe not right now. And all of that is okay, because again, this really, we really rely on the family's expertise. We know they know themselves better than anyone else. We truly believe that. And so we give them our information if they're not in a place or yet ready to partner with our team members. And then when there are additional needs, we know that role and that support is still open for them. We're also explaining just how important and valuable they are to the family voice and choice, that we honor that, so that is normed from the very beginning. We're sharing information for our support groups, and so this really, when we're thinking about pre-crisis opportunities to support, ensuring that families are linked to groups, to shared leadership, to RISO, to the Empowerment Training Center for trainings. Those are all opportunities to support them pre-crisis along the continuum. And then of course, we're sharing some of our lived experience, some of our knowledge of knowing what it's like to navigate these crises and supports, and then ensuring that if there are any immediate resources we can link and engage them to, we do that as well. In the planning process, we are working with youth and families to complete something we call the Transitional Readiness Scale, or the CANS, which is another assessment tool that we are working with them on immediately within the first few weeks of that intake. And this is during that planning phase, and then every 90 days thereafter. So after, and we'll, on the next slide in just a bit, we'll show you what this transition readiness scale looks like. But this allows us to understand how we're going to partner with the youth and family based on the prioritized areas that they've identified. We're going to then also share this information back with their clinicians, their social workers, whoever's a part of that team. We're letting them know these are the areas that the youth and the parent or caregiver have prioritized, and this is how we'll be working with them either weekly or bi-weekly, depending on the needs of the family. And all of that's going to be individualized based on their own needs. This is the transition readiness scale. And you'll see 7 key areas that, regardless of the plan in place, so the therapeutic plan or the case plan from a child welfare lens or scope, from the juvenile justice service plan requirements from a juvenile justice scope, all of these 7 key areas are going to be important regardless of what that plan is. Every young person and caregiver, we want them to be able to set their own goals, advocate for themselves, navigate and access community resources, be able to follow through on activities or plans that are in front of them, manage crisis, increase their support systems, and be able to manage plans. And so research has, again, shown nationally that if families, youth and families are able to accomplish and grow in these areas, again, increases or decreases a chance that they will come back into systems of care when these 7 key areas are strong. So we call it the transition readiness scale, and we're doing it with the families at the very beginning and throughout, because we want to talk about how important transition is at the beginning of services and supports. We call that end in mind thinking. And that just means that from the very beginning, we're thinking about the end in mind. What's the end in mind and how will we get there? And we do that by talking about transition. So there are no ahas, gotchas, or surprises towards the ends of services. And so you'll see the one that starred here is how well are they doing at managing crisis, because we're talking about crisis today. And we know that that's important along the crisis continuum of care of how, what's their ability in doing that. Taking a look at this transition readiness scale, however, we see that there are a couple of areas that this caregiver rated as a lower than the others, and that's what we would prioritize. So under crisis, you see that they rated themselves at a 4. So they're kind of in between able to manage and actively preventing crisis. So that's great. That may not be an area we would prioritize with the family, considering who took this scaling. But they did rate themselves at a 2 for support systems and a 3 for following through. So those would be the key areas that the youth advocate or the parent partner with them prioritize. So as they're meeting with them and scoping how they're going to actively partner together to work on these areas and come up with interventions and talk through why they may struggle in this regard, our team is using their lived experience combined with resources, combined with the trainings and the skills and the knowledge that they have to work with the parent, caregiver, or youth on how to develop skills to follow through better, and then also how to increase their natural support systems. So after they've had the opportunity to engage, get to know each other, they've started working on addressing some of those potential or immediate crises that come up right at the beginning. They've now done their planning. They've prioritized through the transition readiness scale the key areas that they want to work on. I briefly mentioned the CANs. The CANs is one that we also utilize with our family and youth partnership team, but they're focusing specifically on key areas with the CANs. That's for the youth that are experiencing exploitation. So they're using a section of the CANs that directly addresses that. And then for parents and caregivers, there's a section on parent and caregiver resources and supports. And so they're leaning on that section as well, and when the CANs is being implemented. So once they found those prioritized needs and areas, now we're in implementation. So we're thinking again with that end in mind thinking, we're talking about how are we going to implement the strategies that we've identified through the transition readiness scale or the CANs and put that into something we call a work agreement. And the work agreement really just outlines how are we going to work together? What does partnering look like for us? We say there is we something called the COW.
What she's referring to though, in implementation, we're talking about how do we make sure we have a solid plan so we're not getting caught in crisis of the week, which we abbreviate by COW, or COD, which is a fish, right? Crisis of the day. And so how do we create plans with families at the center, utilizing what they want to say to approach their crisis intervention plan, to not get caught in their crisis of the week or crisis of the day? Or how do we walk them through their crisis of the week or crisis of the day, to remind them of their plan, to remind them of their resources? That's the whole point of this implementation series or step.
So as we move families through that implementation, one of the reasons why I was mentioning that COW and that crisis of the week was really because we recognize that there's so many different urgent priorities for youth and families as they're navigating the system. And for my own family, my daughter's challenge was a lot of times she would take off and run away, and that was our crisis. And so we were planning for that runaway behavior. Where she was taking off to, her safety was an area that we were prioritizing. Every once in a while, though, she would also disrupt the school, the classroom, and we would need to address that. That would be my COW. At the end of the day, I wanted her safe and I wanted her home. I didn't want her spending the night in strange places. I didn't want her in areas for days at a time, which was something we were struggling with, that was going to be challenging for us. So the COW would be that she would disrupt in school, and then I would call the whole team, like, this happened at school, and they would help me to recognize not that that wasn't important, but the prioritized need of keeping her safe in the late night hours and on the weekends. And so those were the areas where I needed additional support to remember where I was prioritizing support. It wasn't that we weren't going to address the school challenges, but the family partner and team members helped me to stay focused on the larger plan and the prioritized needs in place. So we've worked through all of this with the families, and we've been in implementation now, and we've been celebrating some of the small successes with family. That's something that's not always mentioned in implementation, but any opportunities where we're seeing progress, we really do want to celebrate that with our families until we reach the point to where there's consistency and progress. Not that we're there, not that we're at the finish line, because one of the things that also has importance is also for us to consider that the journey of the families addressing well-being, addressing crisis supports is something that is a long-term process, that it doesn't end when services end, and that families still continue with their plans of support. So at this point, we're implementing what we call Do For, Do With, Cheer On. And that means at this point, our families, we're in the cheer on phase. We're really cheering them on. When we say Do For, we recognize that at the beginning, families might be overwhelmed. They might need additional support. And there are times when we're leaning in and doing for, so making that phone call for them with the plan that we eventually move them to Do With, where we're working with them and partnering, walking alongside them. So maybe we're making that call with them that they needed to do to connect to the resource that was going to help them. And now we're cheering them on because they're doing it on their own with very little support, and they have their natural support system also to be there for them. We're also exploring what are the long-term needs that can be addressed in their sustainability plans, who are the supports that they will continue to need and be in place. We're working with them on a relapse prevention plan to address future crises. And that relapse prevention plan is another important tool, because we're letting them know that mistakes happen, that we're human, that we're going to mess up, and that's a part of the journey. And so we're really trying to create space to normalize that we all take missteps along our journey, that we all fall back into old habits at times. And when that happens, it's okay. How do we get back on track? And so the relapse prevention plan, when we're addressing crisis, becomes a real strong tool for that for families. And then we're also, of course, then continuing to celebrate their success.
So we'll be talking about how do we elevate family and youth voice in our services. So my colleagues have primarily talked about how do we support families during a crisis while we're in services. Our community engagement initiatives primarily focus on what's our follow-up after crises occur, after families have graduated out of services, and how are we preventative in our approach with crisis as well. So the first initiative that Family Youth Partnership really focuses on is family and youth partnership panels. We structure these intentionally with all program representation. As Christina and Ebony both spoke to, Family Youth Partnership is embedded in every program across the agency. So we're asking our advocates and family partners to identify families who are willing to speak to their experiences. And we're inviting their team members, we're inviting program leadership to hear this feedback live and in the moment so that we can be responsive to it. Although all of our families are navigating difficult situations, we understand that there's marginalized communities that may face additional adversities based on their experiences. So we have held panels specific to certain communities, such as our Spanish-speaking population, where we learned about a lot of gaps in services, down to the translation services that our agency provides, learning that we need to be more mindful and intentional about the dialect that we provide so that everything is properly communicated so that we can be responsive to that. We've also held panels for our fathers, where we learned that communication could be improved and making sure that fathers are included in the process from the beginning of services, as we've learned that our system could be biased towards male caregivers, and making sure that we are giving them what they need to support their youth as well. So a lot of just intentionality in the communities that we're serving, and how can we hear live and in the moment what they need so that we're responsive to it. Community partnerships is another initiative that we had, and making sure that we're empowering families to connect to what's already there. We truly believe that the answer is within the family and within the community. And through holding listening sessions for our transitional age population, they let us know that we're aware of resources in our community. The problem is linkage. So with developing these community partnerships, we're trying to ensure that we're supportive in that warm handoff and the linkage to these community resources. And with the COVID pandemic, we learned of a lot of opportunities where we could support and develop and foster a lot of these relationships. And we learned that caregivers were tapped out, they were stressed, they're home working from home, as well as supporting their kids with distance learning. They became teachers and everything else while they were home. So they needed a break. And we identified the Boys and Girls Club as a potential partner because they offered respite. They offered warm meals. They offered connection for youth who were struggling with isolation. So really making sure that we're connecting with them and streamlining that communication to our families and saying, hey, here's a place where you can send your kids so that you can focus on your work, so that your cup is full enough to come back and support your youth and meeting their treatment goals and preventing a crisis, so that everyone has what they need moving forward. Another community partnership that we've developed is for our youth who are in our CSEC program, learning that employment was a huge risk factor if youth didn't have employment. So with Three Strands Global, we're working with them to educate youth on what is sexual exploitation, what are the risks, what are the signs, how can we support you in having job experience in your educational needs and so forth. So as unfortunate as the pandemic has been, it's highlighted opportunities that we can support with and develop the community relationships. Our Empowerment Training Center is, again, focusing on the growth of our community. As Ebony spoke towards our principles that we work from, our family center principles, team-based and collaborative is something that we really strive to uphold. And with informing our community as well as our agency team members about specific topics. Recently, we had an empowerment training on specifically like building your resiliency from your lived experience. What does that look like? And how do peer mentors pretty much operate from that space, and how can we inform our team members on how we're doing that and how it's beneficial to our youth as well. And it helps to develop more peer mentors in the community. So whatever high need that we see, we try to be responsive to that and provide more education. Recently, there's been trainings on knowing the signs of suicide ideation. As we all are probably aware, we're also navigating a mental health crisis with our youth. Seeing the suicide rates increase and attempts increase since the pandemic. So how do we be responsive to that? What do we need to inform ourselves about and inform our community members about? Because most of our youth that we're serving alongside other team members and systems in the community. So these empowerment training centers are really geared towards improving the knowledge of the system navigation. Gabron spoke towards our shared leadership team earlier in this presentation, speaking how they're specifically focused right now on the follow-up of our on-call survey process. What does families need? How do we be more trauma-informed with that? I don't want to speak to that again, as he already provided a great overview to it, but I would also add that they're also reviewing the consumer survey process for our accreditation right now, and making sure that we're asking the correct questions, and again, in a timely manner and in a culturally responsive manner, and trauma sensitive and informed. So having folks with lived experience in the room to review what we're doing as we're serving them is very important for our program. So our shared leadership team has done a great job with reviewing our processes. As those are our caregivers, we also have a group called RISO, which is our Resilient Youth Speak Out. And those youth are youth who are either currently in services or former youth or just youth in the community. Since the pandemic, we've opened it up to the entire community because it's all been virtual. And we turned it into just a connection space, again, in the essence of making sure that we're trying to prevent crisis. A lot of youth really, really struggled with isolation, and they did not want to come and speak about leadership, which is initially what our RISO group was developed for, is developing leadership skills and advocacy skills. And the youth let us know, we just need a place to be. We just need a place to connect. We just need a place to be heard. So we started hosting movie nights. We started hosting game nights. We started to just gather in that space and make sure that the youth felt like they were heard. And the participation has been high and low because of the constant navigation of the pandemic, but we're now utilizing those youth to say, hey, what can we do to engage youth? What do you all need? How can we be more supportive in preventing crisis situations? And what is our agency doing or can do to better support you all? So really utilizing our youth and families as consultants to the work to inform our practices moving forward. And we also compensate these youth and families for their expertise, because that's what it is, your lived experience. They're able to offer information that we aren't able to gather anywhere else. So the community engagement piece really drives the work that we do in our Family Youth Partnership program.
For those that were present in the first part of the series, these were the questions we were discussing last time, and just wanting to hold space to see if there was anything that has been implemented so far since the first part of the series. And for those that are not, were not there the first one, feel free to also answer these questions. How are stakeholders involved, or have you been involving stakeholders in your crisis planning or crisis continuum process? How are families made aware of crisis and intervention supports? And if you're not able to answer these questions, these are great opportunities to go back to your organization and within your leadership and talk through what resources need to continue to be explored so that more family and youth voice can be engaged in the crisis planning process. What types of trainings do your staff need, or do you need specifically to provide and engage families more in the crisis planning process? And then who's missing? What are the stakeholders that are missing? So if you were here last time, feel free to use the chat or unmute yourself. We just want to hold just a bit of space. And thank you. It looks like participant mics are now open if you'd like to do that. Feel free to share. Again, this is a learning community, so we encourage everyone to share, engage, and learn from each other, not just from those that are speaking, but I recognize and fully am excited that all of us have something to offer. Our questions for our breakout are: what prevention crisis supports does your organization offer? What post-crisis supports do you offer? So there's prevention and there's post. If you were doing a PDSA, which you have now in the chat, what areas of focus would they reveal about crisis response and support? And where is your ability to hear from foster youth or crossover youth in providing feedback?
I will share the group that I joined. One of the things that we talked about was just where do you go and find the folks to gather the information, and how can you utilize that information to influence, like board of directors or board or educational boards or superintendents. How can you gather that information so that it can help continue to change foster youth lives?
We had a conversation about how peer mentorship could be incorporated with her work. There's family partners walking alongside caregivers, but there's a difficulty with engaging youth. And we just talked about the impact of having younger folks with that lived experience, supporting the youth and engagement, and really speaking about what they've just experienced in a way that doesn't feel as clinical and sterile. So excited to see the opportunities there.
I shared from the team, Christina, and some of the things that we have done as a way to kind of elevate voices and advocate for the youth and families that we serve is anytime I know Family Youth Partnership is in a contract monitor meeting with any of our county behavioral support systems or child welfare, there are examples and feedback that are being shared as a way to make sure that we are sharing the experiences that youth and families are having and making sure that we're making practice changes at that level as well. I know in a meeting that we're all in with one of our county contract monitors, they're always asking Christina and Tamisha, any feedback? Do you want to come with me? I'm going to go to child welfare and teach them and tell them this, and this is how it's impacting individuals, and making sure that that feedback is there. So finding spaces, if you're not invited to those conversations, creating an invitation or creating a theme to share out. Another thing that we have also done in those family panels and listening sessions is we're making them a report. Sometimes people read things when it's an unofficial report and findings, and here goes the conclusions and here goes the recommendations. Those are things that can easily be sent out to the superintendent's office, to the School of Education, County Office of Education. So having listening sessions, putting them in a report, and then emailing them out to different stakeholders that you partner with, to saying, these are the feedback, the sessions that we had, these are the themes that came up, and these are the recommendations that are being made forward, as another way to kind of ensure that we're elevating voices. So again, how are you doing that at a small scale, sometimes within just your program, just your organization, but how do you then influence other individuals around you to also impact that advocacy change? So I think those are other really great activities and actions as we think about PDSAs. How are the things that we're making practice changes for ourselves, but how do we influence the arena that we're serving youth and families over as another way to elevate voices as well?
In the chat, they interested in looking at having a peer mentoring program. And so this is a great opportunity for that Plan, Do, Study, Act as you're considering having a peer mentor program, and just what is it? What are the needs there? What would staffing and hiring look like? As well as what other valuable layers of support might they be able to offer in their roles that would be in partnership with your organization. But feel free to unmute yourself if you'd like to share more about that, Maria.
No, it's just something new that we don't really have in place, other than we used to have groups. And so that was a good opportunity for minors to talk to each other about their similar experiences. And while we have mental health outreach workers that are assigned as parent partners, they're not working with the youth in our programs. So having something like that and looking into what that would entail is definitely something that would interests me, and bringing forward to my deputy, and just having that conversation as a start to see what we can do.
Here's the technical assistance link. And finally, thank you all for attending. Thank you so much. And we're really appreciative of those who were able to provide feedback in this session. Thank you all so much for being here today and sharing your experiences and knowledge.